This episode is brought to you by Chirpy Bird Inc. CMS's Merit-Based Incentive Payment System, or MIPS, is super complex, and if clinicians ignore the program or perform poorly in it, it can result in a hit to their revenue and reputation. Chirpy Bird is proud to say that more than 95% of its clients are exceptional performers in MIPS, meaning they've maximized the score that directly translates into their Medicare reimbursement rate. Chirpy Bird offers their audit-proof services to practices of all sizes through an affordable monthly subscription that includes unlimited access to a regulatory expert who guides them in knowing what data to track, how to create workflows that make capturing that data easier, and ensures that they submit it all to CMS on time and performing at its best. Contact Chirpy Bird today or learn more at chirpybirdinc.com. That's chirpybirdinc.com.
Hello there. Welcome to the Hit Like a Girl podcast. I am your guest host, Dana Trampas, and we will be recording live at the Power of Women in Medicine Summit, September 18th through the 20th. We're going to be spotlighting bold voices, real stories, and the fight for equity in healthcare. Dr. Shikha Jain is here with us today, triple board certified oncologist, TEDx speaker, and the founder of Women in Medicine. And I'm pretty sure this is your third time joining us on the podcast, because there's always more to say when the world keeps throwing curveballs at us. Dr. Jain, welcome back.
Thank you, Dana. I am so excited to be talking to you and to see you again in person this September.
Me too. We always have an absolute blast whenever we come to the Women in Medicine Summit. And for someone like me who isn't a clinical person, I got my master's in public health. I always walk away learning so much. I get fired up every time that we come. So this year, what's different? What is different this year compared to the last two times that Hit Like a Girl's been there?
As you know, the 2 days, Friday and Saturday, are always really focused on healthcare leadership, negotiation strategies, balancing your life, fighting burnout, resilience, although I don't like talking about resilience because we shouldn't have to be resilient to survive our jobs. We've talked about everything from navigating crisis to getting up into the C-suite. So that is Friday and Saturday, and you're still going to see that awesome content Friday, Saturday. Friday evening, we have our gala, which we've had for a couple of years, which is where we announce our I Stand With Her award. So very excited about that. But something a little bit different this year is on Thursday, we are actually launching a full day of programming focused on clinical women's health. And the reason we decided to do that is, as you said, Dana, let's talk about curveballs. I feel like we've been spun around and around in the last several months and even the last several years with the things happening with women's health. And there's a lot of concern and confusion as to how we can actually safely provide effective, evidence-based women's healthcare in this country. And I'm not just talking about things that relate to the uterus, because as we know, women are made up of more than just one organ. So we are talking about everything from reproductive health to fertility to substance abuse to climate change, and it's all related to women's health. And we have some awesome speakers. We have Hillary Phelps, who happens to be Michael Phelps' sister, coming to talk on that day. We're really going to have, I think, a powerful dialogue. And in this current time and climate, we realized it's more important than ever. I mean, we even have this year a session focused on if you are a physician and a woman comes in and is miscarrying, and you're in one of those states with really restrictive laws. Legally, how can you still save her life without risking your license or without ending up in jail yourself? And we're doing that in collaboration with lawyers. So we have real experts talking about how do you protect yourself and still be a practicing physician advocating for your patients.
Love all that. There are so many exciting topics that are being talked about in those 3 days. What conversation do you hope sparks something big? What do you hope that folks that attend can leave with?
Well, we're heading towards, and we're actually in the midst of some really challenging times in healthcare with the new bill that's been passed. Whether you're political or not, there's a lot of decisions in there and policies being implemented that are going to negatively impact the majority of the country. And at the summit every year, we have change makers, we have leaders. We also have people who are just finding their footing and getting excited about their journey into leadership. So I really hope that we ignite conversations and create collaborations like we have every year that really will drive change in a national space, not just in the room where the summit is happening. And we've seen it happen every year. I mean, we have speakers who, for example, Dr. Annie Andrews and Dr. Alice Chen, two people who've been very vocal when it comes to advocating for health policy and the health of our communities. So listening to them, and then not just listening to them on stage, but then networking with them, meeting them, talking to them. There's a lot of opportunities to collaborate with people who you might not otherwise be in a room with. And I hope we can really start the fire, ignite a flame that's going to start really driving some change and some solutions-based ways to move forward.
I love that. I love being action-based on things. You've said before, too, that equity isn't just a workforce issue, it's a community health issue. Can you talk to us a little bit about how gender inequities in medicine actually hurt patients?
Absolutely. And it's such an important topic. And I don't think people realize how much it impacts. And equity has become almost a bad word these days where people don't want to use the word equity. And the point that I make is, would you ever tell somebody, when you're teaching your children, you're playing a game on the playground, it's not about excluding people. We're taught to be inclusive. Equity is really about being inclusive. It's about making sure the right person gets the job, but sometimes the right person isn't necessarily even in the room because we aren't being inclusive. So when we talk about how equity at the gender workforce level impacts the community that we live within, there are studies, research studies, data-driven studies that have shown that if you have a female internal medicine physician taking care of you in the hospital, you are less likely to be readmitted to the hospital. If you have a female surgeon operating on you, you are less likely to have a complication, and actually your survival is better. If you have a woman physician taking care of you, they are more likely to spend more time on the electronic medical record responding to your questions. And I always like to emphasize, this is not about us versus them. I'm not anti-man. I have a lot of men who I work very well with, who are my sponsors, who are my mentors. This is about the fact that we are chasing women out of medicine when the outcomes consistently show that women in medicine improve healthcare. They also, studies showed during the pandemic that when there were women leaders, there were less COVID outbreaks, there were better retention of employees in hospital systems. So this is not, again, just about doing what's right because it's right, which it is right? We should be inclusive. It's what we're taught in elementary school. But it's also about the fact that this helps our health. So why would we not want to make decisions that help the health of our communities and of ourselves?
Speaking of elementary school and kids, I saw you on a news segment talking about why parents shouldn't have measles parties. As a mom of a 7-year-old, I have to say thank you. But why do you think public health messaging has become so hard like that, right? Education and awareness. What do you say to parents or anybody who's kind of stuck between that mistrust and misinformation?
I always start with myself, which is I am not just a physician, right? A physician, that's my job. I am a doctor. That's what I do for a living. But I'm also a person. I am a mother. I am a wife. I am a sister. I am a daughter. I make decisions to vaccinate my children. And I, with all of the science and evidence that I know, with the decades of training and school and books and all the stuff I've read, do you think that me as a mother, I would ever put anything into my children that is not going to protect them? These people, these mothers who are sending their kids to measles parties, I am sure they are not doing it to intentionally harm their children. They are doing it because they think that they are doing what's the safest thing for their family, and they're trying to protect their family. So I don't fault them for that. I understand the rationale they have because there's a lot of misinformation and disinformation and just things that people are spouting as opinions that are not facts. I tell people all the time, your opinions don't actually hold any weight against facts and evidence. We can say the sky is green. I can say I am the president of the United States. That does not mean that they are true statements. So we really need to get back to thinking, all right, we don't want to get sick. We're talking about making America healthy and being healthy and holistic care. All doctors care about that too. We want you to be healthy, but we don't want you to get sick. So how do you not get sick? You don't go to measles parties and intentionally infect yourself with a virus that can kill you. And a vaccine is a safe way to prevent you from getting sick. So again, it's going back to common sense and not letting the people who have the biggest platforms and biggest microphones yelling about things because it's giving them some personal benefit. I will tell you, many of these people who had these big platforms talking about anti-vaccine, they made a lot of money from it, and they continue to reap the awards of that by seeding doubt, by getting everybody in a frenzy and a flurry and telling people not to trust the experts. I will tell you, when my car isn't working, I'm not going to fix it. I'm going to take it to a mechanic. I'm not going to take it to a gardener. I'm not going to take it to a plumber. I'm going to take it to a mechanic. So when you are sick, you still go to the doctor, you ask for antibiotics. When you need surgery, you want a surgeon to do it, not your next door neighbor. So why are we listening to people who don't have the education when in actuality, those are the people who have dedicated their lives to helping you and to trying to help you be healthy and stay healthy?
Do you have any advice for other folks who are in the clinical space to start speaking out on social media? Because I come across quite frequently where people are scared or terrified, don't want to lose their lives, and et cetera, et cetera. We know trolls can be pretty nasty. Do you have any advice for anybody who maybe is kind of in that space, if they want to do something, they want to post on social media? What advice do you have for them?
So my advice has actually evolved over the last several years. For those of you who followed me for a while, I did a lot on Twitter pre-pandemic and then throughout the entire pandemic. And then when the Twitter platform changed, I kind of stepped away from that and I moved more towards Instagram, which I'm still learning. Instagram and TikTok and things where I have to put myself out there and put videos. It can be daunting. And on Twitter, I used to post multiple times a week. On Instagram and TikTok, I post a couple of times, maybe a month. LinkedIn, same thing. I'm starting to post more there. But I think it can be scary. It can be scary to engage on social media. But what I tell people is if we are not out there telling the truth, if we are not out there using our education to educate communities, then they're getting their information from sources that are literally preying on their fears. And how hard is it for us as physicians when patients come into the room with stacks and stacks of research that it isn't actually medical research, it's Google searches with information from wellness influencers who are saying, take my magic pill, or a political leader who is saying vaccines are dangerous. But in actuality, none of these people have the expertise or the data to back it up. So our job as physicians has always been to educate the community and protect the health of our communities. However, our community has expanded. Back when I was a kid, there was no internet. There was no social media. So my father, who was a physician, used to educate within our little community that we lived in and then spoke at national conferences. Now our community is a global community because people aren't getting their medical information always from their doctor's office. They're getting it from TikTok or Instagram or a Google search. So I think it's part of our Hippocratic oath to do no harm. Part of our oath of doing no harm is actually getting out there and spreading information. And it might not be social media. Maybe you want to do a TV interview. Maybe you want to write an op-ed. Maybe you want to start a newsletter. There are a lot of ways to get this information out there, but we need to be flooding the airwaves so that the bad actors and the bad information doesn't outweigh the volume of the good and factual information.
I love all of that. I know one of your speakers that you have is going to be running for Congress, and I did a little bit of research on how many doctors do we have currently in Congress, which I'm sure you're not surprised. It's not a very high number. And we have one pediatrician. I looked at all the specialties that we have. I argue we need more doctors in Congress. What do you think about that? Why don't we have some more doctors in Congress out there advocating in those spaces?
I agree with you wholeheartedly because our health policy decisions are being made by our government. And if we don't have people with expertise in healthcare in those spaces, then decisions being made are not the right decisions. So what I would say is I think a lot of doctors aren't involved in politics because honestly, we were taught to be apolitical for years and years. Even now, people post and they say, you're a doctor, stay in your lane. you don't get into politics. But in actuality, it's not our fault that healthcare has become so politicized. Even things that shouldn't be political. A woman coming into the emergency room massively hemorrhaging because she is having a miscarriage from a wanted pregnancy can be accused of murder. And actually, that happened very recently. A physician taking care of that patient, trying to literally save their life, can go to jail. This is not the way healthcare is meant to be practiced. This is not the way we as physicians trained. We trained to treat everyone equally, no matter. The thing that I just saw was in some states, if you are unmarried, there are
Tennessee legislation passed,
where people are refusing to take care of you as a patient because it goes against their belief that you should have a child out of wedlock. I mean, when I was in training, we very specifically were taught if somebody comes in and they're racist, they're sexist, they're a criminal, you treat everybody equally because you are a doctor and you are not there to judge their political views, look at their personal lifestyle habits. You are there as a doctor to take care of a patient. For some reason, something has shifted and the country has decided that doctors don't need to treat every person who walks in the door. I mean, EMTALA still exists, so there's still legal requirement to treat all patients. But in non-emergency situations, we're seeing these things happen that should never be happening. So to go back to your original question, I think that there aren't enough doctors in the government and in Congress. And I think a big part of it is because we were told as physicians, we're supposed to be apolitical and we shouldn't be a part of the government or the government machine. But now with healthcare becoming so politicized, I think that we need as many physicians in Congress as possible. And I will say there are physicians who have different beliefs, right? There are Republicans, there are Democrats, there are independents. So it's not, again, I'm not saying we need one type of doctor, but we need people with healthcare experience, people who've actually taken care of patients, who've been in the hospital and done a spinal tap on a baby who is coming in with encephalitis from meningitis. We need to have somebody who has treated a patient in the emergency room who is hemorrhaging because they're having a miscarriage. We need to talk to those people, have those people making the decisions, because it's really not good when people who've never been in those experiences are making decisions about healthcare that they don't understand. They only know their own personal interactions with the healthcare system.
I love all of that. We need more doctors in Congress and any spaces that have that need, whether it's on social media or news or whatever. We need more voices out there. So I want to try something a little different. I want to try some quick takes with you. I'm going to ask you a question and I just want you to tell me what's the first thing that comes to your mind. You ready?
I'm ready.
What's giving you hope right now?
The next generation of people who are coming up and so impassioned and excited and doing so much work, they are giving me hope.
A moment in your own career where someone opened a door for you.
Oh my God, there's so many. But I'm going to give the example of my dad, because when I was a medical student, I actually was doing some research in his office and he mentored me and sponsored me to submit an abstract to a surgical conference. And I was one of the first med students to ever present at this national surgical conference. And then he helped me with my talk. He helped me with my slides. He asked me practice questions. And then that led to me getting much more comfortable on a national stage. And that was as a medical student. And it actually impacted me in a very big way, because now with the summit, I've tried to do that for hundreds of medical students around the country, because that wasn't an opportunity that was very available when I was a medical student.
I love that. What's a myth about women in medicine you are so sick and tired of hearing?
Okay, I'm going to give you two. One is at the workforce and one is at the health. So at the workforce level, I am sick and tired of people saying that gender inequity is not an issue and that women are just complaining. Like, I'm tired of it. I'm tired of people saying it, because we have the data. Again, your opinion has no place in opposition to my facts. And the data is there. There's a pay gap. There's a leadership gap. There's an awards gap. I mean, those things are there. So I'm really tired of people telling me that I should stop talking about this because it's fixed and I don't know what I'm talking about. I'm tired of that.
Yeah.
The second is women's health, because I'm an oncologist. I'm really tired of people saying that mammograms cause cancer. They don't. Mammograms do not cause cancer. Get your mammogram. Please get your mammogram if you're due.
What's one thing you wish every hospital CEO would do tomorrow?
Oh, Dana, you're going to get me in trouble. I wish every hospital CEO tomorrow would look across the board and make sure every single one of their women is getting paid equitably compared to the men, because it is a problem. There was a study that came out showing women actually lose $2 million over their career just because they're doing the exact same job as their male colleagues, and they are literally losing $2 million in salary a year. Over a career. So I would love for them to do a deep dive and fix that immediately.
Perfect. And last one, give us your last minute plug for the Women in Medicine Summit. Why the Power of Women in Medicine Summit? Why should we go? Why should people come?
I will tell you, obviously, I'm a little biased because I started all of this, but what people have told me is that it is a transformative experience. It is the best leadership program you could ever attend. And even if you're not looking for leadership tips or skills, the people you meet there are going to change your life, whether it's personally or professionally. I've had women who've reached out saying they figured out how to balance their family life and their work life because of advice they got from other women they met. Some of the women who have met there have actually turned into best friends, and they travel together now. Some people came up to me and said, I negotiated a higher salary for my job. Someone else emailed me saying, I was actually able to realize that I was in a toxic work environment and I left, and somebody I met at the summit helped me find another job, and I am so much happier than I was before. So whether you're looking for a transition in your life, whether you're looking to balance in your life, whether you're early career, mid-career, late career, even retired, we have people who come who are out of clinical medicine who are now coaches. We have people who come who are deans. We have people from the military, from rural, from academics, hospitalists, hospital employed. We have everything. You will find your people at the summit. I can guarantee it. And if you don't find your people there, send me an email and I will make sure they're invited the next time. So just come. It's the most uplifting few days you will be there. And this year, for the first time, we're offering flexible registration. So if you can only get away for 1 or 2 of the days, you can register for just 1 or 2 days. We'd love for you to be there all 3 days, but we have flexible options as well. And we have childcare. So if you do have kids, you can bring the kids.
It's so important to have that childcare piece. Well, Dr. Jain, you are our people, and we are so happy to be a part of the Power of Women in Medicine Summit. Thank you for your work, your fire, and for being a guest who always brings the real talk. If you haven't registered for the Power of Women in Medicine Summit yet, do it. September 18th through the 20th at the fabulous Drake Hotel in Chicago. And if this conversation lit a spark in you, share it, tag us, join us. Thank you. I'm Dana Trampas with the Hit Like a Girl podcast.
Thanks for listening. You can learn more about us or this guest by going to our website or visiting us on any of the socials with the handle Hit Like a Girl Pod. Thanks again. See you soon. Again, thank you so much for listening to the Hit Like a Girl podcast. I am truly grateful for you, and I'm wondering if you could do me a quick favor. Would you be willing to follow or subscribe to this podcast, or maybe leave us a rating or review? Or if you're feeling extra generous, would you share this episode on your Instagram stories or with a friend? All those things help us podcasters out so much. I'm the show's host, Joy Rios, and I'll see you next time.